Welcome dear student in Pharmaceutical Chemistry 2. Today we are going to deal with antibiotic. This is part 3 presented by myself Urmila Ravindra Gaudi, Ampicillin Quality Assurance and lecturer in KK Wagh Institute of Pharmacy, Chandori, Nasik. Learning outcomes. After listening, student will able to name a penicillin according to IUPAC system, to recognize the different penicillin on the basis of structure, chemical name and physical properties, and to recognize the different penicillin on the basis of their uses and official preparation with the brand name. Let's start with penicillin. First drug is Benzylpenicillin. It is also called penicillin G. This is the structure of penicillin. Chemical name is 6,2-phenyl ethanoyl amino 2,2-dimethyl penam 3-carboxylic acid or 3,2-phenyl acetamido 2,2-dimethyl penam 3-carboxylic acid or 6,2-phenyl acetamido penicillinic acid. Physical property. It is official as its sodium and potassium salt. Both the salts are white, finely crystalline powder having faint characteristic odor. They are hygroscopic and very soluble in water. They are dextrorotatory. Chemical property. In strong acidic medium, penicillin undergoes degradation, in which both beta-lactam and thiazolidine ring are opened, giving penicillinic acid. In presence of alkali, it is hydrolyzed to penicilloic acid by opening beta-lactam ring. This is the reaction showing in acidic medium and as well as in alkali medium. Penicillin, when undergoes acidic medium, that means in H+ ions, it undergoes degradation in which both beta-lactam and thiazolidine ring are open and gives penicillinic acid. And in alkali medium, that means in presence of OH minus, it opens at only one beta-lactam ring and it gives penicilloic acid. Stability and storage condition. The stability of benzylpenicillin depends upon moisture content. If the moisture content is less than 0.5%, then at room temperature, benzylpenicillin is stable for 2 to 3 years. Hence, it is stored in tightly closed container protected from light. Category is antibacterial. Uses. Benzylpenicillin is a drug of choice to treat infection caused by gram-positive bacteria which do not produce the enzyme penicillinase. It is used to treat abscesses, syphilis, troponium pallidum infection, gonorrhea, gonococcal infection, pharyngitis, pneumonia, meningitis, endocarditis due to staphylococci infection, scarlet fever, pneumonia, endocarditis due to streptococci infection. Again, it is used to treat meningitis, pneumococcal infection, otitis media, tetanus, diphtheria, and anthrax. It is also used prophylactically before dental and surgical procedure to prevent from developing endocarditis and reoccurrence of rheumatoid fever. This disadvantage is that in some individual it produces allergic reaction and anaphylactic shock. Pharmaceutical formulation. It is available in the form of benzylpenicillin injection, benzylpenicillin eye drop, benzylpenicillin eye ointment, procaine penicillin injection, fortified procaine penicillin injection. Brand names: Cirstapen, Pentid and Palm. Now next drug is Benzathine Penicillin G, which is also called Benzathine Penicillin or Benzylpenicillin. It is N-dibenzyl ethylene diamine salt of benzylpenicillin. It is practically insoluble in water and is quite stable at pH of gas and juice. When it is taken orally, it is hydrolyzed in gut, releasing 2 molecules of penicillin and is absorbed through intestine. Due to its lower water solubility and lower release of drug, it has longer duration of action. Property: it is white crystalline powder, odorless and is hygroscopic. It is very slightly soluble in water. Stability and storage: at room temperature and in dry state, it retains potency for about 5 years when protected from moisture. It is also affected by light. Hence, it is stored in tightly closed light-resistant container at a temperature not exceeding 25 degrees Celsius. If it is intended for parenteral use, the container should be sterile and sealed so as to exclude microorganisms. It is available in the form of tablet, oral suspension, sterile suspension and fortified injection. Brand name: Penedior and Longacillin. Now next drug is Phenoxymethyl Penicillin. This is the structure of Phenoxymethyl Penicillin, in which R group is replaced by phenoxymethyl group. Chemical name: 6R6,2-phenoxyacetamidopenicillinic acid. Property: it is white, finely crystalline powder, odorless and has slight bitter taste. It is very slightly soluble in water but freely soluble in alcohol. It is official as its sodium and calcium salt. Storage and stability: it is stored in tightly closed container. Uses: it is used to treat abscesses, pneumococcal infection, gonorrhea, pharyngitis, pneumonia, meningitis, endocarditis, staphylococci, scarlet fever, pneumonia, endocarditis due to staphylococci infection, otitis, tetanus, diphtheria and anthrax. It is also used prophylactically before dental and surgical procedure to prevent from developing endocarditis and reoccurrence of rheumatoid fever. It is available in the form of capsule, tablet and oral suspension. Brand name: Streptafen V, Penitride and Dipen. Next drug is Ampicillin. This is the structure of Ampicillin, in which R group is substituted by phenyl acetamido group. Alpha amino benzyl group. Chemical name is 6,2-amino-2-phenyl acetamido penicillinic acid. Property: it occurs as white crystalline powder. It is odorless and has a bitter taste. It is sparingly soluble in water and very slightly soluble in alcohol. Its sodium salt is freely soluble in water. Ampicillin trihydrate is sparingly soluble in water. It is unstable above 25 degrees Celsius. It is stored in tightly closed container in a cool place or temperature not exceeding 25 degrees Celsius. Uses: it is used to treat following infections due to susceptible bacteria: respiratory tract infection, urinary tract infection, gonorrhea, meningitis, enteric infection, septicemia. It is available in the form of capsule, tablet, oral suspension, sterile solution and injection. Brand names: Rosilin, Ampicillin and Ampifen. Next drug is Carbenicillin. Property: it is official as its sodium salt, which occurs as a white or almost white hygroscopic powder. It is odorless and it has bitter taste. It is freely soluble in water and practically insoluble in ether and chloroform. Storage: in presence of moisture and at room temperature, the carboxylation occurs to give benzyl penicillin. Hence, store in tightly closed light-resistant container at a temperature not exceeding 5 degrees Celsius. Uses: it is an antibacterial agent, but orally it is poorly absorbed. Hence, it is used parenterally to treat respiratory tract infection due to Pseudomonas species, urinary tract infection and septicemia. It is available in the form of injection. Brand names: Carbafen, carbapenem. Next drug is Cloxacillin. It is a semi-synthetic penicillin and contains substituted isoxazole 4-il heterocycle, which is bulkier. Its sodium salt is white crystalline hygroscopic powder. It is odorless and has intensely bitter taste. It is freely soluble in water and very slightly soluble in chloroform. It is unstable above 25 degrees Celsius and is affected by moisture. Hence, it is stored in tightly closed light-resistant container in a cool place or at a temperature not exceeding 25 degrees Celsius. If it is intended for parenteral administration, the container should be sterile and sealed so as to exclude microorganisms. If it is not intended for parenteral use, the label should bear content should not be injected. Uses: it is an antibacterial agent and used to treat staphylococci infection which are resistant to benzyl penicillin. It is used to treat following infection due to susceptible organism: respiratory tract infection, urinary tract infection, otitis media, septicemia, endocarditis, meningitis, bone and joint infections. Pharmaceutical formulation. It is available in the form of tablet, capsule, injection and suspension. Brand name Cloxacillin. Thank you dear student for attending the session. Thank you.